Hello, everyone, and thank you for joining us today on the Dairy Signal. We're going to be diving into calf care, especially within those first 24 hours of care of our calf's life. But before we do so, I have to say happy National Egg Day. I know for so many of us out there, it's a great chance to be able to celebrate what we do every day, but also acknowledge that within agriculture, there's so many different entities and products, and there's so many producers that make sure that the food that we have on our table is possible and is safe and healthy. And so I just want to say a personal thank you to everybody out there who's on farm and in those fields, making sure that that happens every day. So thank you so much for being a part of the fantastic industry we are in. With all of that, I know we've got a lot of really great information to get to here this afternoon. So I'm just going to cut to the chase as we dive in here. And we're joined this afternoon by Dr. Ryan Breyer, who's the clinical assistant professor of large animal internal medicine with UW-Madison School of Veterinary Medicine and is a diagnostic case and outreach coordinator for the Wisconsin Veterinary Diagnostic Laboratory. So, Dr. Breyer, we're excited to have you back on here. I know we've had you on a few times before, but we're really just talking about calves and the first 24 hours of life here this afternoon. But for those who maybe not familiar with who you are or your background, would you mind giving us a brief introduction about yourself?
Yeah, thanks, Amber. It's great to be back on the Dairy Signal again, especially in the new year, 2025. I am, like you said, a clinician at the UW SVM or School of Veterinary Medicine, where I do have a clinical appointment on the large animal hospital floor as a large animal internist, but I also have a split appointment over at the Wisconsin Veterinary Diagnostic Lab, where I work very closely with our different testing sections as well as veterinarians who submit samples. And being from the Wisconsin Veterinary Diagnostic Lab, we see a lot of samples that are sent in for bovine species or cow species. So it's great to interact with those veterinarians who are looking into or investigating herd outbreak disease pathogens, what have you, for our bovine species or cattle species. And one of the topics that I do really enjoy talking about is calf care, and neonates or newborns are hold a special place in my heart because I know that it's a struggle for them sometimes after having a difficult calving or dystocia. So being able to be there and assist in that recovery period after delivery is really essential for these animals. So glad to be here to talk about this topic.
Well, we're excited to have you back on, and especially as we know that the beginning life stages of our calves is so important in order to have a healthy heifer and ultimately a healthy cow down the line. So, we're excited to dive into this, but I also want to mention that if you're watching live or if somebody's out there watching live, you can ask your questions for Dr. Breyer via the Slido feature that's to the right of your screen if you're on a desktop device. And if you're on a mobile device, you can scroll on down below and type your questions in there. So ask them throughout today's session, and we'll make sure to get those questions into Dr. Breyer. But with all of that, I don't want to take up too much more time. I want to get to the meat of it all. So, Dr. Breyer, I'm going to turn it over to you to get us started.
Great. Thanks, Amber. So, like Amber said, we're going to talk a little bit about neonatal calf care within those first 24 hours of life. And I put first 24 hours of life, but majority of the time, that care provided to these animals is within that first 2 to 4 hours. But it is, but it, depending on the difficulty of the dystocia or delivery, it certainly can extend past those first few hours of life. So here's just a few learning objectives that I typically start off with, but I want to make sure that we're all kind of starting from the same place, at least having goals for the calving pen when managing our calving situations appropriately. And what we all want to do is reduce the stillbirth rate for our herd. And when I say stillbirth rate, there is a definition out there that means a calf that is born, obviously deceased or dead at the time of delivery, but it also encompasses those animals that are still alive within 24 hours of that delivery. So stillbirth is an animal that is either born dead at the time of delivery or dies within that first 24 hours of life. And that's how this, where our percentages here today kind of come into capture that information. So stillbirth rate for the whole herd, we target or try to reach for a success of less than 5% within the herd. We know that our first lactation heifers have a little bit more difficulty in calving, and can typically see a stillbirth rate of 6%, but again, we would like it less than 6%. And then all those cows lactation, second lactation and greater, we like to see less than 4%. If we do have a stillbirth rate of greater than 8%, then we need to look into investigate why we're seeing such a high of a death loss or stillbirth rate in those calves 24 hours of age or less, or dead on arrival. And then a lot of times that comes down to training or just recognizing calving and dystocia issues and managing those correctly. I do talk a lot about assisting calves during dystocias, or assisting cows during calving during those hard calving events or dystocias. And we should aim to reduce the amount of assistance to less than 30% of calvings. But if you are assisting more than that, then you have to have a discussion with the management team, preferably having the veterinarian in those discussions as well, to reduce that amount of assistance and give the cow some time, or heifers some time, to calve out appropriately. So I'd like to talk a little bit about calving assistance and why we see poor outcomes with assistance. Typically, there's a lot of research out there that indicates we have reduced calf survival with these animals. We typically have injuries that we see with these calves, meaning that it goes without saying that these animals, when we pull these animals, they can have musculoskeletal injuries. We typically see an increase of calf diseases such as cowers or respiratory diseases, twofold or 2 times as often. And then the cow is affected as well. So lowered milk production within that first 60 days of milk, reduced reproductive performance, so a delay in getting bred back, and then an increased risk of metabolic problems such as metritis, mastitis, ketosis, DAs, what have you. They all have a portion of metabolic derangement in those stressors that occur during assisting in calving. Right. And again, it's really important to understand that we should assist not to speed up the delivery, but to assist that cow in having a positive outcome or a live calf. So we never want to aim to speed up delivery when we're assisting. We want to make sure that we have good progression, that the calf is moving through that birthing canal, and the cow is meeting her benchmarks as far as, okay, we're seeing this calf and she or he is coming at a normal delivery rate. Things to avoid, but sometimes we don't avoid. So, oh, sorry, Amber, you had a question.
No, I had a question. I didn't mean to interrupt. I just saw this one come in, and I think it's perfect on that timing of assistance. Real quick, this one is a question from Slido, and it reads: So with cows that we have twins, we usually assist with the second calf. Should we not?
No, that's great. A great question, and I'm glad you stopped me. So twins are a different story. It's a lot of times we have cows that it takes a while to present that or get a normal presentation of that calf into the birthing canal. And a lot of times they're exhausted, or they've have gone through a lot of their calcium stores, because a lot of times with our heavy milkers, especially, our calcium stores are depleted because of their generation of colostrum. Calcium is at high demand, and a lot of times that effort that it takes to deliver that first calf, you may certainly have to assist on that second calf. And I'm glad someone brought that up, because it's a part of this slide, things to avoid. And don't forget to check the cow for more calves. So it was a perfect segue into this next slide. So if a cow is struggling, especially if she's down and is not having good uterine contractions, definitely assistance is needed for delivery of that second calf in a twin pregnancy. So a little bit further things to avoid is Again, we do see a lot of broken ribs and epicardial hemorrhage. And what epicardial means is hemorrhage around the heart. And as you can see, I'm not sure if my pointer is highlighted here. I'll see if I can bring on a laser pointer. But these little darker spots on the heart, this is the chest of the calf. The lungs are away in this image, but this is the heart. And what I'm circling, sorry, in this image is the hemorrhages of the heart. Also, this arrow right here is pointing to fractures of the ribs. This animal was assisted in delivery, and you can see a lot of that force of the compression of the ribs and even compression of the thoracic or chest cavity can cause these hemorrhages. Now, does this happen on calves that do survive a difficult delivery? Yes, and that's why we'll talk a little bit about what we can do to help alleviate some of this pain, because there will be healing that needs to occur for this calf. So these can sometimes be common, and we can sometimes see this in calves that are delivered normally without assistance. Sometimes it's a tight fit for some of these larger calves. So keep in mind that we can provide enough force when delivering or assisting delivery that can cause some of these fractures as well as hemorrhages to the heart or bruising of the heart. A lot of times we do see when calves are submitted as whole bodies to the diagnostic lab to see if there was an infectious cause of why we're getting so many stillbirths. We see these issues, broken ribs and cardiac hemorrhages on calves, indicating that there was difficulty or a dystocia that was being experienced in these animals. And that's sometimes all we find, which is a good thing, in that we don't find infectious agents causing stillbirth, or the animals have died in the womb prior to delivery because of an infectious cause. Sometimes we do find that, but that's the purpose of diagnostics, and it helps us guide why we are seeing an increase in potential deaths in calves. So keep that in mind. And a lot of times these necropsies can be done on farm by your veterinarian, your herd veterinarian, and then they can send tissues in to the diagnostic lab too. So we don't have to have whole calves sent in, especially if you're not in the near vicinity of Madison or Barron. We have two labs at Wisconsin that can do this for you. But if it's a little bit longer to send in a pretty heavy calf, it can be done by sending just tissues. So, and a lot of this can be diagnosed on farm, especially the more traumatic issues here. And again, don't forget about the cows. Look for those calves that if we have a twin pregnancy, excessive hemorrhaging, if you notice that there's a bit more blood than typical, this is an indication of, if you don't know how to stop that hemorrhage, it's good to talk to veterinarians about, all right, if we see excessive hemorrhage after a calving, what should we do until you get here? Or is there anything we can do? Look for trauma, because again, this cow might need appropriate treatments, whether it's antibiotics or anti-inflammatories, especially in a difficult calving. We shouldn't dismiss the troubles cows can go through during hard calvings, because they can aid they can respond well to different therapies out there. Immediately post-calving, and a lot of these things are things that most of our producers and managers know and do, which is great, but it's good always to have this refresher on what to do. We want to stimulate this calf to breathe, and whether that's trying to coax the calf to take a breath by putting a piece of straw in its nose to stimulate a head jerk. A lot of times that provides the calf to wanting to shake its head, which again will dislodge a lot of that uterine fluid to come out of the upper respiratory system or upper respiratory cavities, the nose and the nasopharynx. We immediately want to kind of sit that calf up into sternal recumbency. So like what we see dogs do when they sit on all four of their limbs, not lay on their side, but sit up sternal. This will allow for the chest to expand and allow those lungs to fill with air. Again, if there's a lot of mucus that the calf isn't shaking out right away, we can use our hands to to kind of stimulate that calf to shake itself, or at least get some of that thicker mucus out of its oral pharynx or oral nasal cavities. We can stimulate the calf to breathe, whether that's rubbing the calf quite vigorously or poking its nasal septum. That's an acupuncture point. Sometimes we do that with our fingers, or we can do that with a needle. I'll show an image coming up here soon. Now we're kind of approaching temperatures where we might be able to pour some cold water or ice cold water over a calf's head to kind of make it gasp. So just think of yourself when you jump into a cold body of water like a pool or a lake. What is the first thing we do when we jump into those cold waters? We immediately go and gasp or deep breathe, and that will allow good expansion of the lungs. It's important to understand that the lungs are not filled with fluid. They're a collapsed organ. And that's one way that we here at the diagnostic lab, or at least the pathologist out on the necropsy floor, indicate whether the calf has taken a breath or not on a stillbirth submission, is whether we have aerated lungs. If the lung that they receive, they throw it in water or formalin and it sinks, this means the tissue is not full of air, but it's tissue. There might be a little bit of fluid there, but it's not the fluid that you're thinking that comes out of the calf's nose and mouth at delivery. This is a fluid that actually helps the lung to stay open. It's called surfactant. And that's the fluid we want there because it keeps the lungs open. It's not copious amounts of fluid. So this is something that's a misnomer, or something that is commonly thought of, and it's false, that there's a bunch of fluids in the lung during pregnancy. Actually, the calf's lungs are not that functional, and there's only fluid in the larger upper airways, what we talk about. So we want to make sure that calf is moved to a clean, dry, preferably warm area, and make sure that we evaluate the calf's parameters, and we'll look at them here shortly. Again, I talked about putting that calf in sternal recumbency, and this is a good image that I received from the beef research folks over, I believe, in Nebraska. They have a good website there, and looking at recovery position for calves. Recover position that puts them in sternal recumbency. We tuck those back legs, you can see, kind of underneath their front shoulders, so that they can't wiggle or slip to the side and lay in lateral recumbency. And this kind of locks them into place so that they can sit in a position that allows for the lungs to fill with air and expand. So make sure that those hind hips are up towards the calf's elbows, and it'll allow for good aeration of the lungs.
So
Here's a good, yep,
Dr.
go ahead.
Brian, I guess it's in the sternal recumbency here. How long do they need to be in this position? And the reason I ask is because I swear you have some calves that are born and they are up and ready to go the moment they hit the ground. But then you have other calves that obviously have a very different story. So how long is ideal?
Yeah, that's great. I have a few benchmarks here in the next slide. It shouldn't be very long, because these calves are prey animals. So the faster that they can get up and start nursing and have good energy to move along, the better, to avoid any prey that might be lingering around. Again, we're in situations where we don't have to worry about prey, but still there are benchmarks that these animals have as far as what nature has made sure that they're capable of doing. So sternal recumbency, we put them in the sternal recumbency to help in expansion of the lungs, but they should hit these different benchmarks, which I'll talk about, I think, in the next slide after this. This is not what I want to see. Making sure holding a calf upside down to drain that fluid from the oral and nasal pharynx, or in that upper respiratory tract. This will only complicate situations, meaning that we're pushing the abdominal organs against the diaphragm that are going to compress or not allow those lungs to expand. Again, making it difficult for that calf to breathe and oxygenate its tissues. It also allows for the fluid that's in the stomach, or the abomasum, because there is quite a bit of fluid in the stomach of these calves, to come up through the esophagus and then refill that nasopharynx or oral cavity. And then when the calf is put down back into sternal recumbency, it'll try to breathe, and then it could certainly aspirate, meaning suck that fluid back down into the respiratory tract, then that's where we experience a lot of this fluid going down into the lungs. So avoid doing this, hanging the calf upside down, whether it's over a bale, it's over a gate, or just holding it upside down by people. So here are the benchmarks that I wanted to touch base on is for normal calves, they should start lifting their head within 3 minutes of delivery. Sometimes they're doing this right out of the gate. And that's what I kind of mentioned before is we should start stimulate these calves as they are being delivered because sometimes they get hip locked and that means we have to rotate the calf's hips within the birthing canal and their chest is outside of the cow. Their umbilicus, which is been providing them oxygenated blood through the cow and through her placenta are no longer there. It's disconnected or at least compromised. So we should start at least stimulating them to breathe if it's taking a little bit longer to deliver them. They should be standing or sitting up within that 5 minutes. So they should be in that sternal recumbency for at least 5 minutes, and then they should be attempting to stand in that 20 minutes. And these are parameters that we should achieve, at least making sure that, all right, this calf is meeting this parameter. And a lot of times I just tell folks to write this down on a piece of paper and then fasten it to somewhere in the calving area to say, it's a good reminder, all right, have we been this far? Is there a clock in the calving area? It's really important to just have a clock or a watch in the calving area to see how much time has gone by. So you imagine that this time goes fast, but actually the adrenaline makes you think time goes faster, and it doesn't go as fast as you sometimes might think, but sometimes it does. So they should start to stand at around an hour, and then they should start to want to nurse or have that suckle reflex by 2 hours, which is a good indicator that we can start giving them their colostrum. Normal vital parameters, these are systemic values that we should make sure that these calves are reaching. Usually 101 to 103 degrees Fahrenheit is what we should see on them. Again, a chilled calf during the winter it might be a little bit lower than this. Their heart rate is going to be a little bit higher than we expect it to be, and then it's going to drop back down into that 60 to 90 beats per minute after a few hours. Preferably, it'll come down a little bit from initial delivery to about 12 hours. And then our respiratory rate should be around that 60 breaths per minute, so about a breath per second, but then it should equalize again within 12 hours to be around 30 or 40 breaths per minute, sometimes even lower, but we shouldn't get too much below 20 breaths per minute.
So, Dr. Breyer, on there you have within 2 hours the calf should be suckling, or at least showing signs of that. I know it's very common and standard within many dairy, producers within their calf system that they have protocols for, getting that colostrum in as fast as you can, within reason.
Yep.
So oftentimes bagging is used. Should we be maybe waiting until these suckling instincts come into play, or should we be with the current standards that a lot of people have in place and just be getting that colostrum in as soon as possible? What's the best option for us there?
It's a great question to ask, and I don't think I have a black and white answer because every animal is going to be different. And there's one thing I do want to say is be cognizant or be able to recognize that we can be too aggressive. Understand that maybe some calves have had some difficulties during a calving, so it might take them a little bit longer to suckle. But again, we don't want to delay that colostrum feeding due to closure of the stomach as well. There's a lot of great research going on currently about colostrum care. And I think that we'll always have this research ongoing because there's always more we can find out and better ourselves with colostrum. But making sure that calf has that feeding available at least by 2 hours is great. And sometimes they're going to have that suckle before 2 hours. So if they are able to, that's great. We'll talk a little bit about administering colostrum here towards the end of the conversation, but I want to get through a few other things. So there's more to come on that. One thing that we have at the University of Wisconsin is this calf score vigor scoring app, only available on iDevices, but it gives a way for producers to track or calf managers to track how well these calves are doing within the first couple hours of life. And then you can go back to these records to see, all right, this calf is 5, 6, 7 days down the road. Are we seeing respiratory issues with this calf? Are we seeing scour issues with this calf? Is this calf a poor doer within the first couple weeks of life? Look back at our calf vigor score and say, oh, this calf had a difficult calving. These are the things that we're recognizing in these calves. So and then it can maybe change our approach to calf management and give these calves a little bit more supportive care, what have you, or help them through those early on stages of calfhood too. But the vigor score stands for visual appearance. So what does the calf look like? Is it meeting those benchmarks that we just saw on a couple slides ago? The intention of movement. Are they sitting up? Are they standing? Are they suckling? General responsiveness. Are they shaking their head? Are they moving about when we stimulate them? Oxygenation. It gives us different color palettes to say, all right, do the mucous membranes of these calves, oral mucous membranes and ocular mucous membranes, look normal, or are there a degree of red that is concerning, or are they pale to blue? And then our rates, our temperature, respiration rate, and then heart rate are all taken into consideration as well. So a little bit of data-driven collection here, but it's good too. And then you can start utilizing this data along the way. Again, available as an app through the UW. Signs of neonatal distress, prolonged time to sternal recumbency. And I have a few marks that I'll talk about there too. But irregular respiration rate is really important. If we don't have a very rhythmic type of breathing, but they're more or less gasping, this may be an indication that this calf is having difficulty breathing. We might have to supplement that with airway clearance or providing the animal with oxygen therapy. This is something that we provide in the hospital, but can certainly be achieved with your veterinarian or discussion with your veterinarian on farm as well. Looking at meconium staining, this is what that calf is, what I'm talking about with meconium staining. Basically, it indicates that this calf has been in utero longer than it probably should have, because both the amniotic and the chorionic membranes have been mixing, and this calf has been exposed to the byproducts of defecation or elimination, and now it is circulating or swimming in this fluid when it was otherwise protected when these two components or sacs were intact. This may indicate that there's fetal stress because of the detachment of the placenta, and these animals might have poor oxygenating abilities once they're delivered. Looking around the white portions of their eyes to see if there's hemorrhage, also an indication of stress, as well as swollen tongue or head. Again, a lot of times calves get caught in the birthing canal, and this reduces the blood flow, both arterial supply and venous drainage of the head, and that drainage is caught in the head, and that's why we see swollen tissues of the head because there's prolonged placement of that calf in the birthing canal. Like I said, acupuncture of the nasal planum or philtrum right here helps to stimulate the calf to at least shake its head, take a deep breath. It's a acupuncture point. You can kind of see this person taking, it's hard to see here, but they can poke that nasal planum either right on the front of the nose or to the side. I typically go right on the front using an 18 gauge needle, not going full thickness, but basically just pricking it, and then the calf will kind of shake itself and kind of be startled and say, what the heck's going on here? So it's important to make sure that we stimulate them. And a lot of times you can do that with just pressure with your fingers. Again, pouring the ice water over the head, it gives that gasp reflex. And that's what we're looking for, is to expand the lungs of the calf. So here's where I wanted to point out like normal delivery and assisted delivery and prolonged sternal recumbency, what you mentioned, Amber, how long should a calf sit there? So prolonged time to sternal recumbency during normal delivery, again, we should see them sitting in that sternal recumbency for about 5 minutes, plus or minus 2 minutes on either side. So they can start attempting standing within 3 minutes of life, which is normal. With an assisted delivery, it's going to take them a little bit longer to come out of that sternal recumbency and want to stand. So about that 9 minutes or so. Again, it can be all the way up to 11 minutes. And then, or sorry, yeah, 12 minutes. And then in very poor prognosis where calves are quite stressed, maybe they're undergoing some hypoxia or deoxygenation of tissue, they're going to be in that sternal recumbency, or worse yet, lateral recumbency, where they're laying flat on one of their sides. This is a poor prognostic indicator for these animals and life, and should be assessed, or at least if there's a plan to kind of go forward, having a discussion with your veterinarian on how these calves should be assessed. Again, irregular or depressed or accelerated respiration rate, meaning the calves are trying to aerate or oxygenate their lungs. If they start to increase their breathing or have hyperventilation, basically, this is not a good indicator that the calf is oxygenating well. Again, blue tinged or cyanotic mucous membranes are an indication that we have poor oxygenation of our blood and poor oxygenation of muscles and tissues of the calf as well. If we have this occur, we certainly can see calves develop neurologic signs because they are trying to create energy without the presence of oxygen. And we call that anaerobic metabolism. So metabolism without oxygen. When this occurs, there's a byproduct called lactic acid. When lactic acid builds up in these tissues, it certainly can get to the central nervous system and cause neurologic signs such as blindness or stargazing, or just unawareness of these calves. We see this commonly in calves that have decrease in the amount of glucose or glucose they're receiving, or if they are having diarrhea, this also can build up in their system and they become acidotic. And that's why you see these neurologic signs.
So, Dr. Breyer, I mean, and maybe we're going to get to this, and apologies and tell me to hold my horses here if we are. And I don't want to necessarily say I'm going to be dwelling on the negative here, but
Mm-hmm.
I feel like, especially on like that last slide where, you had the different recumbency times and all of that good information of how long, until poor prognosis. And we've all had those calves that, whether it be that they were born with some dystocia and they just aren't responding, or maybe they even had what we thought was a normal delivery and they just are not reacting or coming to in a normal way.
Yep.
What do you do then? At
Yeah.
that point, what would you recommend?
Yeah. This again is it's hard because it's definitely different from one situation to the next. So depending again, and this as a calf manager, people that are seeing calf deliveries and working with calves in that first 24 hours of life, this is going to be second nature to them. So they're going to be able to pick these things up right away and say, all right, we got to keep an eye on these. I will say that after this slide, we're going to talk about what kind of different things we can do for these calves to help assist them in this in the recovery of a dystocia or a difficult calving. So again, looking at how we can assess respiratory distress. We kind of went through a few of these, and then also making sure that there's a way to assess heart rate. Sometimes you can feel the heart rate through the body wall or the chest of the animal, but it's always good to have maybe a stethoscope there and then a watch or a clock in the vicinity so that you can see, is the heart rate increasing? Is it staying stable? Is it decreasing? That kind of is a good indicator of, all right, this calf is doing well, or we have to intervene on this calf. So I'd like to show these different respiratory stimulators or providing support to the calves. So can certainly have an ambu bag. It has to connect to something that provides air. You can't just use this without a funnel or something that directs air to the airways of the calf. I like to use these resuscitators, these calf resuscitators. I believe companies such as NASCO, and then you can find them at any farm supply store. They both act as a device that provides air, but also can remove any fluid or mucus from the upper airways. So you can put this cone around this end, and then it sucks that mucus out of the upper airways, or you can put that cone on this end, and then it provides air. And there's instructions both in English and Spanish for these things. And a lot of times I like to see them in the calving area, but you don't necessarily have to use them. So if you've purchased it 5 years ago and it has dust on it and it's nice and clean and pristine, it's good. Then I know that you guys are utilizing or managing the calving well. But it's always good to have something like this around, because it's a little bit difficult. And I always caution people to providing like mouth-to-mouth resuscitation to calves, because there might be some infectious agents that we should be aware of, such as Q fever or Coxiella. This is certainly a bacteria that we have to be aware of in animals, and that it can certainly infect people. I showed this oxygen unit. This has an aerator or regulator on it so that we can regulate how much oxygen is available, because air is not 100% oxygen. Air typically has about 21% oxygen in it. But a lot of times that's fine for the resuscitation of a calf. But if you have calves that have already a hypoxic event going on, they might benefit from some pure oxygen or 100% oxygen. Be careful, oxygen is not risk-free. So that's why I always recommend that there's good education around utilizing oxygen. In the hospital, we have a system similar to this. It's typically built in. We don't have it portable, but this is a system that uses a regulator to know how many liters of oxygen per minute is being provided. It also has a humidifier. You don't necessarily need this for an animal that just needs a little bit of oxygen support for a few minutes, up to 15 minutes or so, because oxygen can be quite drying as well. You want to direct that oxygen to the calf, sometimes cutting the bottom off a gallon jug, and then trying to keep that around the calf so that they can breathe in that oxygen-rich air is good too. If you don't have the opportunity to have a regulator on an oxygen unit, you might be able to assess that just a slow whisper, like if someone would whisper or whistle at you on your cheek, and then you would just be able to feel that air. You don't want it really high that it's just blowing out of one of these oxygen lines, like water coming out of a faucet kind of thing. It's just a gentle breeze. Certainly make sure that it's oxygen you're giving. A lot of times people will utilize something from a torch unit on farm. Again, they don't have the regulators on it. Just be mindful that you're not giving other compressed gases, because this will not have those same effects as in calves. But it's always good to have one of these director cones to the calves. All right, what about CPR? Well, I wouldn't mind giving a CPR class, but unfortunately, that's not in my purview for this Dairy Signals, and it typically is a 4-hour course for veterinary professionals. But it still can be something that is done. Just be mindful that CPR is initiated mostly in neonates, typically adults. It's very difficult to get a cow or adult large animal to respond to respiratory and cardiac compressions. Typically, these animals are in respiratory arrest, which then often precedes cardiac arrest. So we have to make sure that we understand that there's a poor outcome when these animals go into respiratory and cardiac arrest or distress, and the survival rate is fair at good. I know I have right here a survival rate can be as high as 50%, but it's typically around that 10 to 25% with the animals that we would see in hospital. So always call for help because CPR is quite a strenuous type of activity. You should be trained before you start providing it because it's helpful to understand what is needed. Typically, heart compressions are 100 beats per minute, which is, if you sing the tune "Staying Alive," which I think is by the Bee Gees, "Staying Alive, Staying Alive, uh, uh, Staying Alive." This is about 100 beats per minute, so kind of keep that in mind as well. Again, it's very labor intensive, it's expensive. We typically provide some cardiac stimulating drugs as well, but oftentimes it's quite unsuccessful. And that's why it's important to have a good relationship with your herd veterinarian, because they'll go through with you what it needs, what these animals need, if CPR is needed or if training is wanted. There's a lot of times opportunities to do CPR training, but we have to make sure that this communication is had with our herd veterinarians. As I said, we certainly can utilize some cardiopulmonary drugs to assist in these animals that have gone through dystocia, or calves that have gone through dystocia. And a lot of times these are controlled drugs. So unfortunately, the veterinarian cannot distribute them to you. They have to provide them directly to the calf, such as epinephrine or Dopram. These are respiratory and cardiac stimulants, and given too much of or not enough of can cause poor outcomes to the animals. So you have to talk to your veterinarian, talk about these drugs. Again, they have appropriate dosage, so I would not recommend giving them without this education. Typically, it's under the supervision of a veterinarian. Now, controlling pain is another issue that we can certainly address too. Again, speaking with your veterinarian and talking about the different NSAIDs, or non-steroidal anti-inflammatories, such as Banamine, Flunixin, Meglumine, and then Meloxicam, the oral tablets, are definitely things that calves can benefit from. So this image of this calf that I have here, we have that swollen head, and a lot of times that's due to inflammation and congestion, and a lot of times this can be relieved with anti-inflammatories. So it's good to talk to your veterinarian about this, and whether you should consider these forms of non-steroidal anti-inflammatories, or NSAIDs. Some people ask about steroids. Now, there's a time and a place for steroids that typically don't provide neonates steroids, as it can be an immune suppressor, and these calves are already immunonaive when they're born, so suppressing that immune system is not a great position to be in. So there's a time and a place for steroids. I find that when appropriately dosed, NSAIDs, or non-steroidal anti-inflammatories, are given, they can help these calves quite significantly. Again, routine procedures, making sure calves are identified, whether that's with ear tags or what have you, umbilical cord care, utilizing some type of drying and disinfecting solution is important. So iodine and chlorhexidine are good treatment options for calf dips. Do not use teat dip, that doesn't help. And then if you are going to use a teat dip applicator, make sure that it's cleaned between calves, because these, you can certainly develop bacterial biofilms and then transmit dirty naval pathogens from one calf to the next too. So be mindful that these things do require cleaning maintenance as well. Drying and warming of calves, you might see these calf warming hutches, or I've seen plenty of different warming hutches that are homemade. Make sure that they can be easily cleaned and disinfected, because these devices certainly can become a petri dish, incubated petri dish, quite quickly. As soon as the calf defecates, we are contaminating those environments with bacteria right away. Early colostrum administration, again, is key, and we'll talk about that here in the coming slides. We're kind of getting out of the season of these calf blankets. Sometimes they are used in emergency situations. Again, the black attracts heat, so it keeps that calf warm, and then the silver or sometimes gold helps heat that radiates off the calf, then gets reflected back to the calf, so it keeps them nice and warm. They're a bit expensive, around $8 to $10, and they have 1 or 2 uses in them, so not often seen, but certainly can be beneficial in those cold weather born calves. Colostrum quality, that's really a good portion of calf management. Again, we want to make sure that they have adequate exposure to it within that 2 to 4 hours after birth. I do have a link here that's a good YouTube video on how to appropriately tube calves with an esophageal tube feeder, which is important because just yesterday we were evaluating a calf that was calf tissues that were sent here to the diagnostic lab, and there was inappropriate placement, and it ruptured through the esophagus. So you can certainly provide excessive force to esophageal tube feeders and cause a detrimental effect. This calf died because of a poor placement and management of esophageal tube feeders. Here's a little bit more about a few of the studies that Dr. Sockett, myself, and a few others here at the diagnostic lab as well as the university have looked into as far as colostrum, providing colostrum to calves and evaluating that colostrum. It's not only vital to get the colostrum into the calf at appropriate timing, but also making sure that that calf has good quality high mass of IgG concentration administered to it. So it's important to kind of see what your options are. These are the 2 publications that are quite recent. If you haven't taken a look at them, you certainly can. I believe they are free access online. And what we kind of looked into is looking at aspiration pneumonia events, pharyngeal and esophageal trauma. So the pharynx is where the oral cavity and the throat and airway and esophagus meet. We know we've looked at rhuminitis, reticulitis, omasitis, and abomasitis. These are all inflammation of the forestomachs or the rudimentary stomach of the calf. Looked at how 4 liters of colostrum followed by 2 liters, which is kind of been reported as the go-to treatment therapy for calves nursing. Notice that they don't nurse for 10 to 36 hours after this type of approach. Is this good or is this bad? There's a lot of discussion about this, and we're seeing that it can certainly be reduced so that we don't have these calves waiting these extended period of time going between their colostrum feeding and their next feeding. So, and then also know that when the calf, the colostrum and the calf, or the colostrum is fed to the calf, we can certainly see that there is colostrum curd formed, and this is normal. We want the separation from a whey to and a colostrum curd because that separates the protein from the other components that form a curd, so that we can have this protein-rich fluid that contains IgG or the immunoglobulins to be absorbed lower downstream by the intestinal tract, which is good. But sometimes these curds form at different rates and at different weights and can certainly cause delay in emptying of the abomasum, which can certainly, in most complicated cases, can lead to death. So we did a few studies. Like I said, this is one of some of the guidelines that we've developed here. We know that cows can do a great job in concentrating their colostrum, and we see and we've tested that they can have over 100 grams per liter of IgG in this colostrum. The serum So evaluating calves' transfer of passive immunity guidelines, these have stayed quite consistent, and we're trying to reach that excellent category with having greater or equal to 25 grams per liter of IgG found in that serum of the calf. So if you're doing this and evaluating transfer of passive immunity status, this is great, a way to indicate whether you're receiving good passive or good transfer of immunity through colostrum. Again, there's benefits of feeding a colostrum, smaller colostrum volume, especially if you're able to understand that the colostrum has an IgG concentration of greater than 75 grams per liter. You can be strategic in this application of colostrum, know what's best for the calf and their well-being, and you can make the colostrum work to your benefit by then conserving some of that really good high-quality colostrum for calves that might not have a dam or a cow that produces a good high-quality colostrum. So increasing that farm supply. One more thing to kind of go back on this, it was kind of pertinent to this talk. I was walking through the grocery store yesterday, and I saw a bovine colostrum supplement in the store for people. This was a supplement that you can add as a nutritional dietary supplement, typically utilized in bodybuilders, but otherwise good for good nutritional support that people want to purchase this. It was a container that was 180 grams. There was a 2,000 grams of bovine colostrum powder in this. So there was 90 treatments, so a 2-gram treatment in that, and that vial or that little container, it looked like infant formula that you would feed to a baby in the size of a container about that big, and it was $35. So it's even very expensive, and we know that there is a lack of colostrum supply on our farms, and now there's an even higher demand for people to consume bovine colostrum. So buyer beware, and understand that we can certainly utilize colostrum to our benefit, but know that there is demand outside of the farming or calf world as well. I know I'm probably getting long in the tooth on this discussion. My apologies. So here's a few take-home messages, and I can take any questions.
So, Dr. Breyer, one of the questions came in earlier, and I was holding it for a bit here because I knew we had some slides to get through. And this one, I think I'm going to put in a little bit of my dialogue here, so I apologize here. But
No
when
problem.
we think about calves and quality of life and making sure that they have the best quality of life, this question leads into from Slido. Given its poor prognosis, is it even worth CPR?
Yeah, so that's a great question. I mean, we can try. There's been a couple instances where when we try CPR, we will cause fracture of the ribs as well. But it's easier to manage a fractured rib than a dead animal. So if a calf is struggling to survive, certainly there are ways to help that calf with a humane euthanasia, or a way to put that calf down, because we know of the poor prognosis. We can certainly do our best to provide life-giving support, but again, know that even with those life-giving support processes, we might still have the same outcome, or likely have the same outcome of death.
Well, thank you for
So
addressing
I
that.
don't know if that answered the question, but I can't say if a calf is suffering, should we or should we not try CPR? Again, in the instances where we could try CPR and we do, and the calf dies, or if we don't, and then we help them pass on with euthanasia, that's also appropriate sentiment as well.
Well, I think it's a great way to think about that, regardless of the situation. I mean, like you mentioned earlier, you have to assess the situation at hand, and it may or may not be worth, the benefit of what may happen later. But with that, one of the other questions I have for you here, Dr. Breyer, is, you've had a lot of experience both in the veterinary med side and the diagnostic laboratory side, which gives you a unique glimpse and look at what's trending and what's going on within dairy, especially in the calf side of things. So, what is, one or two areas that from your experience you just wish producers would take a little bit more time or maybe a little bit more practice around that could really make all the difference, especially when it comes to the first 24 hours of a calf life?
Yeah, great question. So again, a lot of times we want to rush in and help out a situation, especially for neonates. And I'm along with everyone else that's in the calf managing or the maternity pen. I want to step in and help as much as I can. And sometimes we're a little bit of too aggressive in our approaches. So letting time take its place and knowing our benchmarks when to intervene or not. Again, this is important to have this conversation with veterinarians because they're going to want to have input at the table as well. Say, all right, if we are having an issue with stillbirths on farm and we want to kind of step back a little bit in being aggressive in assisting, what are our benchmarks? When would you like to be called if we're struggling in trying to deliver this calf? We know that it might take our veterinarian an hour to get out here because they live that far away. And they might not be able to get there within a half an hour to 20 minutes. This is good to understand. So being a little bit more cognizant of how soon we can intervene is really important. Again, with intervening in calves that already have been delivered, making sure we understand or have a good knowledge of those different interventions, whether they are drugs or procedures being performed, are good discussions to have with a veterinarian. And I am certainly open to having those discussions with your veterinarian too. If they're not able to see this presentation, we can certainly talk about this as well. So it's all kind of goes into being too aggressive, but also making sure that we know kind of the subtleties of what makes a calf successful through these difficult calving issues, and what will produce a calf that's going to struggle. Again, just like with colostrum feeding, we want to make sure that they have high adequate concentration as far as mass of IgGs being consumed, but we can certainly be too aggressive and feed higher volumes that they might have difficulty digesting and then lead to further issues down the road. And again, we're still investigating these issues and trying to become better at that. And I know there's a lot of new information about supplementing or enriching or fortifying colostrum with colostrum supplements that should also be discussed with your veterinarians or with people that are researching this as well. Because not only can we potentially fortify colostrum, we can also put too much supplement in there that can cause detriment to the calf and its GI tract as well. So there's a lot of good things that we can provide to make successful calves productive cows in the future, but we also have to be mindful that those inputs can certainly go beyond that boundary and cause detriment to the calves as well.
Okay. Now, Dr. Breyer, it is 1 o'clock, but I've got two questions for you if you got the time.
Yeah, go ahead.
Okay, so one of the questions that's often asked is, how often should we be reviewing our calf care protocols? In some instances, it's this isn't the wheel isn't broken. Why fix it type of situations. And other times, we have new information that comes along that may be beneficial to review and look at. So what's kind of the happy medium within it all?
Okay, great question. At any time a new employee is hired in those larger production units is when training should occur. And then training should, at bare minimum, occur every year on a yearly basis. I like to do biannual training, typically when we see, or even quarterly training, typically when we see changes in weather. So in Wisconsin, we have four quite unique seasons. So typically I describe them as hot, cold, really cold, and wet. And that's our summer, fall, winter, and spring. Sorry, I might have. Can you hear me? Okay, good.
Now I can hear you again.
Great. Sorry about that. Have a little bit touchy microphone here. But I find that we might have different protocols. So again, when we change things for calves, such as a week to those pre-weaning calves, maybe we're increasing their caloric need. We might also need to increase the amount of heat or warmth that we provide to calves in colder seasons versus summer seasons, where we might have to make sure that they are in drier type of environments, such as the spring and summer. So training can be as often as quarterly or as infrequent as once a year, but I would not go more than once a year, just because it's good to go through things, and anybody becomes compliant in what they do, and it's good to say, "All right, I forgot about that," or "Oh, that's really good. I have to pay attention to this more." So that's how I would kind of structure my training and retraining.
Okay, fantastic. And then last question for you here today is, as we've gone through all this information and we've got a lot of it at our fingertips here to be thinking about and looking at and maybe reviewing our protocols that once a year here. With all that being said, what's kind of the key takeaway or something that you want producers to be thinking about or actively doing after today's discussion?
Yeah, that's a great question as well. I like them to think about, all right, what are we doing to manage these calves within the first 24 hours of life, and how are we doing? So looking back at records, how many live viable calves we have, how many dystocias we are noticing, and then how many calves are we potentially allowing to get behind that 8 ball if we didn't provide some kind of support to them within that first 24 hours of life, and see if they can improve on that. But also be aware of, like, all right, if we are doing really well, great. Give yourself a gold star and continue to do the training and a great job of assessing these calves appropriately and providing well-needed support if needed.
Okay, well, thank you so much, Dr. Breyer, for your time here today. It's always important to go through these areas, especially when it comes to the very beginning of what ends up being our cow herd. So much appreciated your time here this afternoon.
Great. Thank you very much. It's always a pleasure, especially to talk on a topic that I enjoy to talk about.
Well, I have to say as well, if you're somebody watching, thank you for asking your questions, and I hope you enjoyed this session as well. And I do want to give one last shout out here to our program that we have coming up for carbon crops and cows next week. If you are in Kewaunee, Wisconsin, or in Sun Prairie, Wisconsin, we have 2 really great sessions for carbon crops and cows. If that's something you're interested in, you can still get registered online at pdpw.org. But for now, thank you for joining us here today, and we'll see you here tomorrow on the Dairy Signal. Bye now.